Welcome to TV20 Showcase. I'm Jessica Lundy. Everyone wants to have a beautiful smile, and today I'm talking with Dr. Kirk Doolin about the new technology that will help you achieve it sooner. Now, I'm seeing a lot of new information on commercials and social media about teeth in a day. So what does that really mean, and is it safe?
Yes, it is safe. It's kind of a buzz phrase that's out there, but it refers to replacement of missing or diseased teeth with implant-supported bridge work all in one day. It's kind of a misnomer, really, because there's so much work that goes on behind the scenes with digital planning, CT scanning, 3D technology that lets us find out where the best bone is, where we should put the implants for the best support, and then the key to it is tying them all together with some custom-made bridge work. That's what allows us to do it all in one day and actually have the patient be functional the day that they leave the office.
Which is so important. So I'm hearing a lot about bone grafting when dental implants are discussed. So can you touch on this?
Yeah, well, often, when a tooth is lost, the supporting bone melts away, up to 60% of the volume in the first year alone. So oftentimes when we want to go ahead and place implants, we have to build up the bone around the area a little bit, and we have products that allow us to do that.
So can any dentist perform dental implant surgery?
No, they can with proper training. Your best bet is to go to an office that really is geared up for it, both educationally and experience and technology. You really have to know what you're doing. It's not the average dental practice.
Well, thank you, Kurt, for this helpful information. Go to discoverdh.com or call 248-537-2900. TV20 Showcase is sponsored by Doolin Haddad Advanced Dentistry.